well, first of all, a Happy New Year to you all. And it looks like this government is starting this new year exactly as it finished the last one. And the dreadful, shameful spectacle of citizens on chairs, on trolleys, of 800 people who shouldn't be in hospital at all, who are discharged but they've nowhere to go that will give them any sort of comfort, is all a very, very direct result of the austerity policies which have been pursued relentlessly by Fine Gael and Labour. And if you cut the nurses, if you cut beds, if you take a fifth of the health budget away, and if you just destroy the community sector and the home care packages and all of the rest of it, then this is what happens. And the way to finish it and distort it is to end that policy. And that's our very, very clear message to the government. It's meeting at the first cabinet meeting. The only news that will have any positive effect upon citizens here will be an end to austerity. And I want to ask Caoimhghín to deal with the current, yet another crisis in health, if you would please, Caoimhghín.
Yes, well, this is almost becoming a hardy annual, and we have to recognise that the crisis that we're witnessing in our hospital sites throughout the country is a direct consequence of government policy. Not only this government, in terms of the Fine Gael Labour coalition since February 2011, but the government that preceded it, the Fianna Fáil-led government that preceded it over those previous years. And we're looking at a significant underinvestment in our health needs. We're looking at an under-provision in relation to beds, in relation to nursing staff and other key players within the community health sector. Support staff that would make a critical difference and hopefully, would have contributed to the prevention of more and more people having to present at hospital sites and very especially in A&E departments. We're calling once again on Leo Varadkar and on Tony O'Brien, the Director General of the HSE, to recognise that there isn't a single solution approach to this. Tony O'Brien's interview yesterday morning with Morning Ireland on RTE, it was absolutely outrageous that he was totally and absolutely locked into a single approach, i.e. in terms of those who are in discharge units up and down the length and breadth of the country, but for whom there is no immediate step-down facility or nursing home bed. It's very important that we recognise that within the hospital network across this land there are wards that can be recommissioned. There are beds that can be put back in service. What we need to do is to start immediately to recruit the additional support staff, the nursing staff most importantly of all, in order to ensure that these beds, that particular additional bed complement, can be properly used and used effectively and efficiently. And it will not be resolved by Leo Varadkar's approach this morning of moving beds here, moving beds there, footering about with the situation, but actually not doing anything constructive to allay the situation for those who are unfortunately placed in trolleys and beds and other inappropriate placements, and indeed for the heroic frontline staff that are trying to cope at this time right across the hospital network.
How would you rate the Health Minister's response so far?
I think it's pathetic, I have to say, and I'm deeply, deeply disappointed. I would have expected more from Dr. Varadkar in this instance, and I think his late response to a crisis that has been unfolding over a period of weeks is simply not good enough. And I think it is very, very important that he heeds the voices of the representative organisations, not only of the doctors, but very especially the INMO, in relation to the solutions required. And he should act on those and act on those immediately.